hello, ma'am. Hello. Hello, ma'am. Yes, ma'am. Yes, yes, yes. Mm, yes, ma'am. Yes, yes. Yes, ma'am. Ma'am. मैम वो जो लिंक का नाम है ना JNT EJVV इस पे क्लिक करेंगे ना तो आपको पार्टिसिपेंट्स मिलेंगे। Good evening, ma'am.
Can everybody see the screen?
Yes, ma'am.
Yes, ma'am.
So today's topic is Smile Please. It's an oral health literacy seminar. I have seen in my clinical practice that a lot of people are not very aware what goes on inside their mouth. So this is an issue issued in public interest. So what all will we be covering in this seminar? So what is it? What is oral hygiene? What is, you know, how do you how can you say that okay, I have a good oral hygiene? How can you self-diagnose and be like, okay, yeah, my teeth, my oral cavity are in a good condition? Why is it important to have a good oral hygiene? What is in it for you? Third topic is the consequences. What is going to happen if you don't take care of your teeth and gums the way that you should? And lastly, we are going to talk about prevention of, basically to save you from going to the dentist and spending your hard money. As you know, dentists are quite expensive. So let's get into it. So, what does having a good oral hygiene mean? Firstly, your teeth are clean and free of debris. So, what is debris? Debris is basically a thin layer of plaque, whitish layer that forms on your tooth if you don't brush properly, you don't take care of your teeth properly. That is the first and foremost indicator of having a good oral health, good oral hygiene. Secondly, your gums are pink and they don't hurt or bleed when you eat anything or when you brush your teeth. I don't know if you all remember, there was an ad, I think the whole ad, which, so there was an ad in which the female, she takes a bite of an apple and, gums start bleeding and there is blood on the apple. She goes and shows it to the dentist gives her a toothpaste. So, something like that. We are going to get into the detail of gum disease later. Um, Next is no bad breath. Your breath should not be foul smelling. You think other people cannot smell it, but they can. And no pain. You should not have pain when you chew, or in general, if there is pain, if some tooth is paining, if there is a pus formed, obviously you do not have good oral hygiene. And no cavities. This is something a lot of people ignore. Okay, if it's not painful, it must be okay. No, it is not okay. Why, we will get into it later. Why is it important for you to take care of your oral hygiene? First and foremost, you are going to be able to eat freely. Now, what does it mean by eat freely? So, when you have pain, you obviously can't eat whatever you want. Many people, what they do is, if they have pain, they, instead of going to the dentist, they just take a medicine and they start eating from the other side. Then they make these teeth also go bad, and then after that they will go to the dentist. So that is not what we want to do, especially as young people. This age of yours is very important. If you can take care of your teeth at this stage, you are going to you know you're going to be very happy in the future in terms of not having to go to the dentist again and again and getting yourself injected with local anesthesia. It is not a pleasurable procedure. Nobody likes it, obviously. So you're going to be able to eat freely. If your tooth has gone bad, you know and if you have had to extract it recently, there are certain things you can't do for a few days. Again, your eating is compromised in those cases. Also, when you have sensitivity, if you drink anything hot or cold or eat anything hot or cold, you experience a very sharp a sensation in your tooth. That is called as sensitivity. Again, that prohibits you from eating certain types of things. So if you take care of your oral hygiene from the beginning, you're going to be able to eat freely without any restrictions. Nextly, you're going to be able to smile freely. You can see in this photograph, this person, whoever he is, obviously did not, pay much uh, mind to his oral health, and one after the other, tooth started falling out or they became loose. He had to extract them, and then his oral hygiene was not good. Another thing is that when you have caries in your front teeth, obviously when you smile, it is going to be visible, and you're never going to know when it reaches the pulp, the nerve of the tooth. After that happens, then you have to get a root canal, then you have to get a cap on that. And the cap is, no matter how expensive the cap is, maybe like certain Emax crowns which are for 10 to 12,000 per crown will look like your actual tooth. Most of the other crowns, you can make out, okay, there is something artificial in this person's smile. So it is important to maintain your oral hygiene because you're going to be able to smile freely, without any issues. Next is you're going to be able to breathe freely. Like I said, if you have a bad breath, it's not going to be good for you and the people around you. Nextly, you're going to be able to spend freely. We're going to get into the details and the exact costings, approximate costings, not exact, approximate costings of dental procedures later. And if you don't have to pay them, you obviously have money for yourself and you can spend on yourself. Now, what are the consequences? What happens if you do not take care of your teeth like you are supposed to? First and foremost, which I'm sure most of us have, is cavities. So now, what are cavities? I'm going to show you a few photographs. I want all of you, after this seminar, to open your mouth and look in the mirror, take a flashlight, look in the mirror and see if you have any of these, and go to a dentist or self-diagnose or go to a dentist, whichever works for you. So as see in these slides, these are called as caries or cavities in layman language. So bacteria is the main reason for this to happen. How and why it happens, we will get into it in the next slide. So obviously it's not going to happen overnight. You're not just going to wake up one night and there's going to be a huge like this, a huge cavity in your teeth. It has stages. It starts from a very tiny stage, and then when you don't take care of it, when you don't you ignore it, it comes to this stage. It does not happen overnight. The stages, as you can see in the first slide, in the first column, it is a very tiny cavity, very tiny. It is called as a pit and fissure. It is just a small dot or a small line on your brownish discoloration on your tooth, and most people ignore it as usual. Even in the second stage, it is a small pit, and most people ignore it because at this stage you are not going to have sensitivity, you are not going to have pain. So this is something that goes unnoticed by maximum population. So this whitish layer that you can see on the top is the enamel. Enamel is the hardest structure in the body. Even your bones are not as hard as the enamel. And these bacteria, they are so um, they are so strong, and they are so harmful that they can eat away the hardest structure in your body. So please don't take it lightly. In the first two stages, if you are able to, diagnose it and go to a dentist, and at that stage, it is only going to be a normal filling for you or a normal cement, which can cost you from anywhere around. If you go to a very charitable clinic, maybe it will cost you 100 rupees, and if you go to a high end clinic, it will cost you 1500 rupees, 1500 or 2000, depending on where you go. But it starts from 1000 rupees, from 100 rupees, sorry, it starts from 100 rupees if you go to a charitable clinic, and your tooth is going to be safe. Once the cavity is excavated, once the cavity is removed and filling is put into it, it is not going to happen again. That is going to stop right then and there. But if you don't go to a dentist at this stage, you are going to go into the third stage of caries development. The second layer of your tooth is called as the dentin. When the cavity reaches this stage, what happens is that you will start experiencing sensitivity. Like I had told you before, when you eat something hot or you eat something cold, you are going to experience a very sharp sensation in your tooth, and that is, sensitivity has a lot of causes. Obviously, this is one of the causes because we are talking about cavities. So even at this stage, if you go to a clinic and be like, okay, I want to get this filled, even this is going to be just a filling for you, and you can save this tooth with its natural form even at this stage. But if you ignore this also, it is going to go into the fourth stage. Now, every tooth has its own nerve supply. Obviously, when you feel pain in an area, it is obviously innervated. So, there is a nerve supply in each and every tooth. So, this fourth stage is what is basically your nerve gets involved in that stage. What happens when your nerve gets involved? You will experience pain. Now, when you start experiencing pain, many patients are, they are very confused. I never had any such issue. How come all of a sudden I'm experiencing pain in this? It is because you do not go for regular dental checkups and you ignored the sensitivity in the past, or maybe you did not feel any sensitivity in the past. All of a sudden, now you have pain in a tooth and you don't know what to do. You're gonna go to your dentist. Your dentist is obviously going to suggest you to get a root canal. Now, root canal is where the problem begins, because root canal is something, first and foremost, you are going to need injection for that, and nobody likes to get an injection. So you're gonna get your root canal done. Costing wise, costing is more for root canal. Even at a charitable clinic, if you go, it will be somewhere around 2,000. 2,000 is the starting range of a root canal, like roundabout. 2,000 is the starting range. And if you go to a high-end clinic, they will charge you maybe 5,000, 6,000 for one single tooth. So it is like that. And in the middle, 2, 3, 4, anyway, or like depending on where you're going. So, and is sometimes root canals are done in one sitting also. Sometimes they take 3 to 4 sittings depending on your tooth, if there is an infection or not. So all these complications happen when you ignore your oral hygiene and when you have pain sometimes what happens is, this is very rare, but I've seen it in my clinical practice, is that people, they ignore pain also. They will go to a dentist, they will take antibiotics and they will take pain killers, they will complete the 3-day course and they will forget it. Now, what happens when you do? They will, or maybe they will just take a medicine from the nearby medical store and just start chewing from the other side, whatever works for them. For n number of reasons, maybe any reason, not to judge anybody. But this, when you ignore that, what happens is your nerve. Can you see this? Your nerve starts. So what happens is your nerve is inflamed already, and if you ignore the initial tooth pain also, there is going to be an infection that starts forming under your tooth. This is called as a periapical infection. This happens in mostly it happens in long-standing cases, which is called as chronic periapical infection. Sometimes the infection is so severe that it happens even when it's the first time that you go to a dentist. That is called as an acute chronic. That is called as an acute periapical infection. But most of the time it happens in patients. Most of the time it happens in patients who ignore the initial tooth pain and just take medicines for the time being, what happens is that there is an infection under the tooth, and then they end up looking something like this. There is a swelling on the outer surface, as you can see. That is because there is a tooth over here which is infected, and there is a periapical inflammation, there is a periapical infection, and that has gone into the bone and into the soft tissues, and that is why this female is experiencing this swelling. Now, even after having a swelling, your tooth, depending on the condition, how much structure is left, your dentist might be able to save your tooth by doing a root canal. Or if the dentist feels like this tooth cannot be saved, the dentist extract, move the, remove the tooth. Again, it's not going to be a pleasurable procedure for you. You are going to be given an injection, and then the tooth is going to get extracted. So we really want to avoid that. And even after extraction, you can't just leave an empty space. So what are you going to do? With that empty space. So if you get an extraction done, you're gonna have to replace your teeth. Then you're gonna have to go for a bridge or for an implant. If you go for an implant, it will cost you something for one single tooth. If you go for an implant, it will cost you from 25,000 to 50,000 for a single tooth. If you go to a college, maybe if you go to reasonable clinic, maybe a little lesser, but nothing less than 15,000 for a single tooth. So it becomes very expensive, and it is a painful procedure for you. Implant for lower arch will take 6 months to completely finish and completely heal. So it's a long-term procedure as well. You don't have to go to the dentist every day. So once a while you have to go to the dentist, but it becomes a long procedure. It becomes a complicated procedure for you to do and endure. So please try to avoid that. Next, what happens if you don't take care of your oral hygiene is gum disease. Now, maximum people are unaware of what is gum disease. If your tooth has cavities, maybe you'll even find out once in a while. But what is gum disease? Most people are unaware. So now, in your lower teeth, on the inside surface, if you see something like this is called as tartar or calculus accumulation. This yellowish calculus that is accumulated, and sometimes when you brush there is bleeding from this area. This is not good. This can be removed by scaling. It is a very simple procedure. It is not going to cost you much, from 500 rupees to 2000 rupees, anywhere in the middle of that, but very reasonable procedure. Second is bleeding gums. Again, like I said, when you brush, you have your gums are bleeding. That is another sign of gum disease. Third is loosening of teeth or tooth mobility. And fourth is recession. So what is recession? What happens is, can you see in these teeth, there is tartar accumulation and the gum line has gone down. The gum line is not where it should be. So when, even in this case, the gum line, look at this tooth's gum line. Can you see the pointer?
Yes, yes, ma'am.
So in this tooth, the gum line is over here, which is where it is supposed to be. But in this tooth, the gum line is over here, and because the gums have gone down and the bone has gone down, your tooth is now loose. And even in this case, your gums have gone down, so there is spacing everywhere, which does not look good. It's not aesthetic, and also it causes a lot of functional disabilities like bleeding gums and loosening of teeth. There are a lot of causes of this, this happening. Is if you have diabetes, I would urge you to take good care of your teeth and regularly visit your dentist, because diabetic patients are at the highest risk of gum disease. Even patients who have heart diseases or patients who are on certain drugs. Whenever your physician is giving you any sort of medication, you should always ask if there are any side effects. There are some drugs like phenytoin and anti-epileptic drugs which cause inflammation of the gums, swelling of the gums, and if you are pregnant or if anybody that you know is pregnant, they are at a very high chance of getting the gum disease. Pregnancy, actually, it's very common for pregnant women to have gum disease. There are a lot of patients who complain that, oh no, my teeth were fine, and I don't know what happened during my pregnancy, because obviously when you're pregnant, you have like 100 other things to take care of. You don't really take care of what is happening inside your teeth. So then the tooth becomes, and then you have to go for. So what happens during recession, gingival recession, if you have tartar and if you have bleeding gums, something can be done. You can get scaling done, like I told you. Your dentist will prescribe you a mouthwash or a toothpaste, and in most cases that will provide you with the necessary relief. But if your teeth are loose, there are grades of mobility. There are teeth which we can save by splinting them or banding them together. There are teeth that we can save. Otherwise, if the mobility is too high, we do not have a choice but to remove that tooth from the arch. Because there's nothing that can be done which will help us save that. Now, if you have recession, like in this case, there is a recession, you may have to go for flap surgery. Now, flap surgery is a very complicated procedure. You're gonna have to go to a specialist for that, and they are obviously going to charge you accordingly. So, in order to avoid the higher end things, we should take care of ourselves when it is a tiny dot, basically, like in cavities we saw. So similarly, it all starts when it all starts. It's obviously not as huge. Like the gaps will not be so huge, and even in this case, you can see the gingiva has the gums have started to go down a little bit. If the patient goes to a dentist at this stage, the dentist may be able to prescribe something and not let it go to a higher stage. Now, as you can see, this is a comparison for yourself, and a healthy gum is pink in color, and in Indian skin tone, it's not exactly pink. It may be a little pigmented, it may be brown, but it is definitely not going to be reddish. And this is the actual line, gum line. Anything beyond this, you might be at a risk of recession. The lower teeth are more at a risk of recession. So that is. Now, the next reason why you should take care of your teeth, and this a lot of people are interested in, obviously, is that it does not look good. It is unaesthetic to smile when you don't have good teeth. Maybe looking something like this, there is caries all over one tooth. There, in this case, if I don't know if you can make out, but there is a root here. The tooth was carious in his case. The tooth was carious, and he did not take care of it. And slowly and steadily, it got chipped off and it got fractured. And now only the root is left inside his bone, and the tooth structure, the crown structure, is gone. So obviously, it's not very pleasing to look at. A lot of people are conscious about their smile because of dental reasons. Nextly, in this case, you can see there are a lot of stains. People who smoke, people who have hookah, people who have whiskey or any sort of tobacco. It's very common in India. They have stains all over their teeth, so it does not look good, especially like this. This is for somebody who has misery or anything. As you can see, there are a lot of stains. These are a few photos of before and after. this patient, had a chipped off front tooth, which has been built up by using composite, by using cement, and all her stains have been removed. And as you can see, such a beautiful smile she has now. Again, in this case, tooth whitening has been done because in some cases, people from birth they have very yellow teeth, or people who drink tea a lot. That is another reason why people have yellow teeth. If you drink a lot of tea, when we were kids, we were told chai ke baad pani nahi pi. So we don't do anything after we drink tea, which is actually wrong. Even if you don't want to drink water, you should rinse your mouth. Very important that you should rinse your mouth after you have any colored beverages to avoid staining. Now in this patient, his teeth, his gum line has gone very down, and there's a lot of recession, and he has a lot of mobility. This tooth is mobile. These teeth are mobile. There is a lot of calculus and everything. So in this case, what has been done is that a denture has been given because there was no chance to save his teeth, so a denture had to be given. Next is bad breath. Next complication of not taking care of your oral health is bad breath. Now, what can cause bad breath? Smoking, infection. If you have an infection in your tooth, dry mouth. Dry mouth happens due to certain medications. There may be a complication of dry mouth. People who have diabetes, there is something called as diabetic ketoacidosis, which also, there's a very sweet smell that comes out of your mouth, very pungent. Uh, Alcohol, if you are an avid drinker, you may have bad breath. Coffee causes bad breath. Obviously, bad oral hygiene. We are going to get into it. And diet, something like onions or ginger, whatever you have, causes bad breath. But all these causes are temporary. You brush your teeth and it goes away, except if you have an infection or if you have bad oral hygiene. Just brushing your teeth is not going to get rid of your bad breath. Even if you brush your teeth after a while, for that time being, your breath may smell fresh, but after a while, it is again going to smell. Now, what in your teeth causes this bad breath? As you can see in this patient, there is a lot of tartar accumulation. I told you what tartar is a few slides back. Then there is, you see this whitish film on the brown tartar is plaque or debris, which was the first point of what does it mean to have a good oral hygiene, is that there should not be any debris on it. The oral hygiene of this person is obviously not at all good. So it's common sense, right? When this person opens their mouth, their breath is going to stink. So in this case, as you can see, there is tartar accumulation, and the tartar was removed by scaling. Even the gum line has gone down, but because of the scaling, in the second photo, you can see the gum line has gone back up to its original position. The gum line goes down in such cases because of the tartar, and the tartar is pinching your gums. It is constantly pinching your gums, and the gums are forced to go down. So even in such a case, all this tartar, all this bacteria, all this debris is going to cause your breath to smell bad. Then there is caries and pus formation, another reason for bad breath. You can see in this photograph that there is a pus formed underneath the tooth. It is because of the caries, and the caries were not taken care of. So now there is a pus under the tooth, and many a times this pus, this is a closed pus. Many a times this pus breaks out and breaks out into the oral cavity, and that is can cause a bad breath. Even in this teeth, as you can see, it is completely carious. So many cavities are there, and there is food accumulated. Obviously, whenever there is caries, there will be food accumulated inside it because the bacteria, it is food. Our food is food for them as well. So there is food accumulated inside the caries. Obviously, there is going to be a very bad breath. Next is the build-up on tongue. Now, a lot of people ignore this. People just think that if we brush our teeth, it is going to be good enough for us. But that is not true in most cases. We ignore the fact that our tongue is like how our teeth are capable of having a plaque buildup. Our tongue is also capable of having a buildup. So this is what it looks like before, and if you keep your tongue clean, it is supposed to look pink and healthy, not whitish or brown or any other color. It's supposed to look pink and healthy. Brown may be okay, some like because we have an Indian skin tone, there is a lot of pigmentation. But if you think that it is something out of the normal, you should consult your dentist. Another thing is, so how do you take care of your tongue? How do you take care of it? There are things that are available in your normal medical. Every medical has it. It is called as a tongue cleaner. It looks like this or like this. I'm going to show you a video later on how to use a tongue cleaner because most of us are unaware of these products. So I'm going to show you a video. Now, what have we no, like what have we covered so far? We have covered what is ideal oral health. We have covered why it is important to take care of our oral health. We have covered what will happen if we don't take care of our oral health. What are the causes, specific causes of these diseases, and what are the treatment options that are available for us. Now we are going to come to the final part, which is the prevention. How do you prevent from it to have if you have a good, like if you don't have any cavities yet, what can you do to make sure that it does not happen to you? And prevention is also for people who have young kids or who who know young kids, who have people young kids in their house because young kids are most susceptible to caries because obviously they don't take care of their oral health and then they have pain. And even though they are milk teeth in most cases, milk teeth also the final shedding, the last tooth to shed will shed around 11 to 12 years. So there are a lot of patients whose teeth have gone bad at 6 years of age, and now there are 6 more years for that tooth to get removed from the oral cavity. Now at 6 years of age, that poor child is going to be injected with local anesthesia, and root canal is to be performed or extraction is to be performed. Whatever it is, obviously you cannot keep the child in pain for long, so you have to do something or the other. So prevention is also for people who have kids around them, and people with diabetes and everything. So that's it. First and foremost is that you brush at least twice a day. This is not a recommendation कि 2 बार brush कर लोगे तो अच्छा हो जाएगा. No, you have to brush at least twice a day. Once in the morning after you wake up, and once at night before you go to bed. Okay. So what happens when you don't brush in the night is that when you are asleep, your mouth is obviously closed and your bacteria are having a party inside basically because you did not brush your teeth, and now there are food particles everywhere and the bacteria is going to feed off that food particle, and it is going to damage your tooth. So first and foremost is to brush at least twice a day. Secondly is to floss regularly. Again, many of us are not aware of what floss is. I will show you a video regarding that. And use tongue scraper, one we just saw, and visit your dentist every 6 months. There are a lot of things that you cannot diagnose on your own. It does not cost you much to visit your dentist every 6 months. It is not something that is so huge you cannot do it or anything. It is a very reasonable thing. You can go to your dentist every 6 months. Just go for a general dental checkup. Just if there is a small cavity, if there is a filling, get it done, and stop it at stage 1. Now, correct brushing technique. There is going to be a video at the end of the presentation about the correct brushing technique. We just brush it any which way that we want, and what happens if you don't have the correct technique is that your teeth start to wear off. Your teeth, there is a saucer shaped effect, something like this, on your teeth, near your gums. When you brush fast or you use a hard toothbrush, you are supposed to use a soft toothbrush. If you use a hard toothbrush fast, then your teeth are going to start wearing off, and it's going to start looking something like this. This is called as cervical abrasion. Second is you floss. Now, why is flossing important? Why should you floss? So what happens is when you eat your food, obviously not all your teeth are perfect, not all your teeth are exactly spaced. There are some teeth in which there is space in which food can get accumulated, called as food impaction. Now, when food gets accumulated in such areas, you even after you brush, the brush may not be able to reach in such tiny spots. What starts to happen is you think you have brushed and now you are good to go, but a decay or a cavity starts forming adjacent to that area because the bacteria starts feeding on the food and it starts decaying your teeth. That is why flossing is also very important. So hopefully we can. It is not very difficult to do all these things. It is really not very difficult. It is very basic, and when you want to lead a certain life, you have to live a certain way. So obviously, if you do all that, hopefully all of us can have a beautiful smile and yeah, take care of yourself, take care of your parents. You know, you can also, you are young, you can ask them to open their mouth, and there are some things which even you as a layman can understand. If there is a caries, if there is a decay in someone's tooth, you as a layman also can understand. You can take them to the dentist and you can get it fixed as soon as possible. The more you delay, the worse it is going to be for you yourself. Like we don't mind it, obviously. We are going to get more money if you delay your treatments, but it is going to be you who is going to be at a loss. So yeah, thank you so much for this opportunity. We are going to go to the videos that I was going to show you. First is the brushing technique.
The modified Bass technique of toothbrushing is used by patients that have good manual dexterity and limited gum recession. The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pocket surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 45-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.
So in this video, what we saw is first she was brushing these teeth. So you need to take your time, because this is just a short video. She has done it in a very quick manner, but you need to take your time. You should brush for at least 2 minutes. uh, you can do 3 teeth at a time, and go about it completely throughout your arch. Once all your front surface is covered, all your back teeth as well. Many people ignore the back teeth because it is not very reachable, but you have to brush the back teeth as well. And once all the front surfaces are covered, then you go to the inside surfaces again, the same circular motions, and then you sweep it upwards so that all the debris is outside. Then you brush the occlusion or the biting surface of your tooth, and that is how the entire procedure is completed. What we do is we just we take our toothbrush, and we just brush it here and there, or we are just roaming around with it all over the house, and we are just brushing it for the sake of brushing. That is not effective. Second is how to floss correctly.
And use it to clean in between your teeth, the interdental areas. There's lots of types of floss. You can get waxed or unwaxed, or you can get tapes. Essentially, you need to use the floss that is best for you. And if you go to see your dentist or hygienist, they will be able to go through the different flosses and maybe explain which one is good for you and why. The reason why anyone needs to floss or do any dental brushing is because you don't have the space around your teeth for the toothbrush bristles to get in there. So if you can get your toothbrush in between your teeth and get the bristles to go all the way through, all the way up and down, then you wouldn't need to floss them. So that's the only reason anyone does any dental brushing. The technique that you can use when you floss is to open your flosser like so. Remove about 6 inches worth and just on the end. Wrap it in between your fingers so that you've got about 2 inches worth of space in between your fingers. Essentially, the smaller amount of space that you have here, the better, because when something's really long, it's hard to get it inside your mouth. So a nice small amount of floss in between, about 2 inches. You then slide this down in between your teeth, and you follow the contour of the tooth, so it goes underneath your gum. You then slide it back out and remove all the debris out from in between that tooth surface. You then go back down, and then you go down the other tooth, the adjacent tooth, follow the contour of the tooth, and then bring it back up, and then bring it out. You do this on all of your teeth, go all the way around the mouth, and at the end of doing this, you then go over and brush your teeth, so you're removing all that debris away from your teeth. Once you remove the debris from in between your teeth, you can move along to a fresh piece of floss so that you're not reintroducing the same debris back into that tooth surface area. Dentists recommend that you floss at least once a day, and you floss before you brush your teeth. This is so you can remove the debris away from your gums, and then it can be brushed away at the end. When you start using floss, don't be disheartened, because you might find it's difficult to use. You might find that you're ripping areas and it's getting stuck. So if you go to your dentist or hygienist, they'll show you the correct way to use it and how to use it. All different sort of gaps and tight areas in your teeth as well. Again, when you first start flossing your teeth, you might find that your gums are bleeding. Your gums are probably bleeding because they're inflamed because you haven't been flossing or cleaning previously. So if you floss correctly and remove the debris around your teeth, then over a period of time your gums will start to heal and the bleeding will stop. You can floss at all ages, so you can start quite young, so you get into the habit of flossing. So essentially, as soon as you're sort of 8 or 9 years old, you floss them, have your teeth in there, you can start flossing. You should floss your teeth all the way through. But to floss your teeth, you need 2 teeth next to each other. So if you've got a tooth which is standalone, really you don't really need to floss that tooth because you've got enough access all the way around that tooth to be able to brush it well. There's lots of different types of floss. You can use the string floss that you wrap around your fingers and you put down between your teeth, or you can use these preloaded flossets, which are on long reach, good for back teeth, or you can use these ones, which you don't have to then use your fingers to wrap around, and again, they're preloaded, good for your front teeth as well. If you go to your dentist or hygienist, they'll be able to show you which type of product is best for you. You could also use something called a water flosser. So this is almost like an electric flosser. You have a tank of water that's held within this flossing movement, and you hold it right next to your gums, and a jet of water jets in between your teeth, and it removes all the debris and all bits of food left next to your gums once you're sort of moving that jet of water around your gums. So that's another really good way of cleaning your teeth without using all the plastics that come with the flossing and faucets.
So in this video we saw what is flossing. First of all, why it is important, why you have to do it, and how to do it. You get wax floss in any medical. You can get a wax floss. Colgate is considerably reasonable, and there is Oral B, a little bit on the a little bit more expensive Oral B as compared to Colgate. Colgate wax floss, everybody can use it. There are these preloaded sets also. You go to your any chemist, and ICPA preloaded floss comes. It is a packet of I think 15-20 floss sets, something like this. It looks like this one, like this one. It looks like this. There is a set of 20 or more floss sets, and you can use that. But these are disposable. You cannot reuse floss like how you can reuse your brush, and you have to change it. You have to change your brush every 3 months. But these floss uh, sets, you have to throw them after every use, and you have to clean them after every tooth, so that the bacteria and the debris from one tooth does not go to the other tooth and infect that tooth also. So it does not take a long time. It Once you get into the habit of it, maybe in the beginning it will take you a little bit longer, but once you get into the habit of it, you are going to not take any time at all. Also, another thing that comes with flossing is you feel very fresh afterwards, because you can feel like the difference between just brushing and flossing and brushing together, because all your interdental areas are clean. Now, this water flosser she's talking about here is a device a lot of people I've recommended it to. You can get it on Amazon for around 2000, and it is something that is going to last you for a lifetime. This tank, you have to fill this tank with water, and essentially what it does is that there is a point, and you could just keep that point on your gum line, and a jet of water will come out, and it will clean all the debris. So that is your water flosser. That was about flossing. The last video for today is going to be about tongue cleanings. That's it. That's all there is. So it was so easy. You don't have to do anything. Just show it again. That's it. That's all you have to do. It is so easy to use a tongue clean. You just have to run it under water before. Use it on your tongue, like as it was just demonstrated. Wash it again, and you can reuse it. It is not something that you have to dispose of every time you use. You can reuse it, and it is so simple, and it is so helpful. Because, like I said, it's not difficult to take care of your oral hygiene. It's really not. So yeah, that's it for today. That's all from my end. Thank you so much. Thank you.
Thank you, Dr. Zoha. What an amazing and a very, very informative session. Can I now request Sahil from my department? Sir, can you please propose a vote of thanks on behalf of all of us?
Yes, ma'am. Hello, everyone. Good evening.
Question answer, Prana madam.
Yes, yes, if they have, please. Doctor, I have a question first to ask you.
Yes, yes,
Yeah,
sure.
Dr. Zoha, I just wanted to ask you, there are so many toothpaste of commercial brand in the market. So whenever you go for a toothpaste, what exactly you have to look, what we should look when you are buying a toothpaste? Is it an ad or is it that rate? What is the condition when you buy a toothpaste?
Okay. So it depends from person to person. Like there is a different toothpaste. If you like, if your teeth are good, if you don't have any issues, you can basically use any toothpaste that you want. Any toothpaste that whose taste that you like, you can use it. Just the only condition is that the toothpaste should be fluoridated. Fluoride is something that helps make your enamel stronger, especially with kids. If you are with kids, you should always give them a fluoridated toothpaste. Um, and if you don't have any issues, you can just use any toothpaste which the taste of which you like. Now, if you have bleeding gums, then you need to use a specialized toothpaste for that. Now, what happens in such cases is that there are a lot of brands. Um, Colgate and Pepsodent are something that we know about, but these are, how you want to apply something and something that is dermatologist recommended and something that is famous and cosmetic. So it's something like that. So that is why if you have any issue, you need to go to your dentist and be like, my gums are bleeding. Do I need to use a special toothpaste for that? Again, if you if you have any other issue that you are facing with your oral mucosa, then you need to tell your dentist, so this is happening, what do I do about this? If you have bad breath, you have continuous bad breath, your dentist may recommend you a different type of toothpaste, maybe a mouthwash along with the toothpaste. So, yeah. Something that I wanted to add about mouthwashes is that mouthwash is not something that is recommended for a long time. If your dentist has recommended it to you, then only you should use it for a long time. Otherwise, mouthwash is something you should use occasionally if you want to freshen your breath after half an hour after brushing. Half an hour after brushing. You are not supposed to eat anything half an hour after you use the mouthwash. So, yeah, this is something not many people know about. So, just put it.
Thank you, doctor. Thank you so much. Yes, is there any other question to the doctor?
Okay, so
They want
Joel Costa has asked after brushing with fluoridated toothpaste, should we rinse it with water or just spit it out? Ideally, you are just supposed to spit it out. That is what you should do. But a lot of people don't like, if you're using a very minty toothpaste, they don't like the taste of it, so they rinse it with water. And it is what we have been taught since forever that you should rinse it with water. But ideally, after you brush your teeth, you are simply supposed to spit it out, not rinse it with water. And eat food after a certain period of time, at least 20 minutes, 15-20 minutes after you have completed this, so that your teeth can get the maximum benefits.
Dr. Zoha, can I have a question, please?
Yes, sure.
What is the difference between floss and the interdental brushes which are coming now? Because rather than using floss, I'm relying on interdental brush which are coming in two sizes. So which one is better and which one would you recommend and why?
Okay. So interdental brushes are not something that everybody will benefit from. Interdental brushes are something. Can you see this? This is a replica of the human
Yes.
jaw. It is not
Yes.
It's not real, don't worry, it is made of plastic. So in this, the contact between two teeth is very tight. Interdental brush is for someone who has quite an amount of spacing to their teeth. Because if you use interdental brushes in this case, you're not going to get anything out. You're instead going to lodge it in even more. So again, this is also something which has to be clinically assessed. If you have a continuous complaint, okay, your food is getting stuck somewhere continuously, and if you have a lot of spacing, interdental brushes is what you should be using rather than anything else. And because obviously, if you use a floss in an area which has a lot of spacing, your floss is not going to be able to give you a lot, of um,
Thank you so much.
so Roshan wants has a question. I
टोपी दे
guess
टोपी
Roshan Fogarade.
Yes, he's Roshan, sir. Ma'am, I posted a question for you.
Okay. So my friends are fond of chocolate cakes. How often can they consume? Okay. So this is a very good question actually, and I want everybody to listen to the answer very carefully. So what we have taught kids and what we have been taught throughout is that you should not have sweets because it is bad for your teeth and it is going to decay your teeth. Now this although it is true, it is not the complete sentence. So you can consume sweets, you can eat whatever you want, as long as after eating it you are rinsing or you are brushing. Depends on the day. If you are eating and if you are just rinsing and all, it's all stuck to your teeth, obviously it is going to create problems for you. Now it is like you are asking if your friends are fond of chocolate cakes, how often they can consume it. They can consume it as much as they want, as much as they find it healthy. It's not a healthy thing to eat, so they can consume it as much as they want, long as they are taking care of it afterwards. Many people, they say, मुझे मीठे का शौक है इसलिए मेरे दांत खराब है. No, that is not exactly true. Your teeth are not good because you are not taking care of them afterwards. So yeah, that is the answer.
Thank you, doctor. Thank you so much.
Okay, somebody has asked what are the best ways to practice good oral hygiene at home. It's like I told you, brush twice a day, floss at least once a day, and spit every time you have anything. Rinse your mouth. Sorry, rinse your mouth every time you have anything. If you think there is something stuck in your tooth, even in the middle of the day, you should have it removed. Otherwise, it's going to be stuck there. The bacteria is going to come. It is going to take full advantage of the fact that there is food stuck there, and it is going to decay your teeth. Joel de Costa has asked, after filling in tooth, it pains. What does that indicate? Okay. So many times what happens is that due to one reason or another, there is still some amount of decay left inside the tooth, even after you've had a filling done. Maybe for any reason, maybe the dentist did not remove it properly. Maybe maybe it is an underlying condition. Maybe your bone is receding. Maybe there is some infection interdentally. So when you have a pain even after filling, it is indicative of nerve involvement. You should go to a dentist. You should get an X-ray done. Many a times, what we feel is that we are having pain in this tooth. Even after I got a filling, there is a pain in this tooth. But what happens is that the adjacent tooth, the tooth right next to it, is decayed, and we feel that it's this tooth. So whatever the reason is, there are a lot of reasons. You can just go to your dentist, get an X-ray, and they can tell you what can be done. change root canal cap, like how can we keep it? This person has asked. So, I don't know if I understand your question properly. Are you asking about the crown, that is the cap that is given after root canal? So if you are getting a cap after root canal, you don't need to change it unless and until it is switched off or it is removed on its own. You don't really need to change a canal cap. Swati, Swati has asked what are symptoms of first stage of oral cancer. So, can you mute yourself, please?
Yes.
Can you? Yeah, thank you so much. So, what are the symptoms of first stage of oral cancer? Now, as any other cancer, oral cancer is also something which first stage is not really easy to detect, which is I don't know, you must have seen in movies that directly people detected in the third or fourth stage. In oral cancer, what are the symptoms of first stage? If you ask me, actually in oral cancer you can detect even before cancer has happened. It is called as a pre-malignant lesion. There are innumerable pre-malignant lesions which your dentist can detect for you. Some of them might include if there is tightening of your cheek muscles. I'm talking about your cheek muscles. If there is tightening of your cheek muscles, if there is whitish lining on your cheek, on your inside of your cheek, on the inner surface, if there is whitish lining, if there is whitish, thread like linings or anything of that sort. Now, people who keep, gutka pouches, where you keep the pouch, there will be a brownish discoloration or a whitish discoloration. um, you know, like when you see it, you're gonna know that this is not supposed to be normal. So these are one of the starting stages of oral cancer.
Doctor, I just want to ask you one thing. In doctors like dentists, we see normally people with BDS and MDS. When is the time to go to an MDS? When should we approach an MDS, or for a routine checkup it's only a BDS?
Okay, so yes, for a routine checkup you can go to a BDS. Even for normal procedures like extractions or root canal treatments or your um, fillings, you can go to BDS. But when you have to get more complicated things done like implants, or if you want to get braces done, you can go to an MDS. There are 8 specialties of dentistry, so it is very vast, very vast. Um, so if you want to get braces done, you have to go to an orthodontist. If you want to get flap surgery, like how I told you before, if you have gum recession and you want to get flap surgery done, um, now, if you're another thing, because this is a young crowd, I want to tell you all is if your third molar, akkalad or third molar, whatever you call it, is going to come. It comes around the age of 18 to 22, and more often than not, it does create an issue. It does create pain, and when you take an X-ray, and if it is still in the bone, it is called as impacted. If it is impacted there, it is not able to come out. In those cases, you go to an MDS rather than a BDS. So these many cases, your general dentist will only tell you that a specialist is going to come for your case. So you don't have to exactly stress so much. Next question somebody has asked: are chewing gums good for your teeth? Obviously, they are not. Like if there are flavored chewing gums, obviously they are not. Now these Oral B and everything, they market it by saying that it's good for your teeth and it's going to help your teeth. That is not exactly true. Maybe they've I don't even think that it whitens your teeth. Actually, they have marketed it like that. That ad with that guy becomes a chandelier. That is not what happens. obviously all of you must have tried it. Nobody experienced any teeth whitening or any benefits from that. So no, there are some chewing gums that are bad for your teeth, but like these oral B unflavored ones are not exactly good, but they are not bad either. So along those lines.
Any more questions?
Yeah, sure. What? Do you wanna ask something?
So should we tell Sahil to propose a vote of thanks, ma'am?
Yes, yes, yes. Please.
Sahil, please propose a vote of thanks on behalf of all of us here.
Okay, ma'am. Okay. Hello, everyone. Respected Dr. Zoha, ma'am, and all members present here. Good evening, one and all gathered here on this wonderful evening. It gives me an immense pleasure to deliver the vote of thanks. I would like to thank our chief guest, Dr. Zoha Shaikh, who honored this function. It was an amazing and learning session for all of us. I enjoyed this session. On behalf of Risby Education Society of Science, Arts and Commerce, I extend a sincere vote of thanks to our honorable guest, Dr. Zoha Sheikh, for your informative session, which will go a long way to help our students, patients, and understand the concept of oral hygiene. I thank you once again for the same. Have a nice day. Thank you, ma'am.
Yeah, ma'am, it is time to say end this particular session. And it is said that life is a camera and keep up smiling. And Dr. Zoha has given us hundreds of reasons and methods by which we can keep on smiling. I thank Dr. Zoha on behalf of Department of Chemistry. I also sincerely thank Dr. Anjum ma'am. And with your permission, ma'am, can we end the session for today?
Yes, yes, yes. Sure, sure. And thank you all of
Thank you, doctor. Thank you, ma'am. Thank you so very much. I hope you like the session, ma'am.
Yes, yes, yes.
Thank you, Zoha, doctor. Yes, yes. Thank you, madam. Thank you, Dr. Zoha. Thanks all the participants. Signing off for today.
Yes.
Thank you, ma'am.
Thank,
Thanks.
thank you, organizer.
Thank you, ma'am. Thank you.